question that we get all the time, particularly when our phones are being answered, are how much is it to fill in my gap, how much is it for an implant? And we kind of want to break down the confusion of why, you know, we tend not to just give a number over the phone, is because we don't want to lead you down a path where that's really not realistic, and we, you know, our preference is to be able to see you, to be able to guide you a bit more, to see what's going on and advise you ideally. Now, just to break down that confusion, a lot of people think that the implant is the tooth and what they see is part of the tooth. That's what we refer to as the restoration. The implant itself is actually the piece that replaces the root of the tooth. So that's the small piece that's buried underneath the gum, and you don't see that. We don't want you to be able to see your implant at all. We want you to see the porcelain work or whatever type of restoration it is that we are placing over the top of the implant. Now, a question that we also get all the time is, how many implants do I need? Do I need an implant for every single tooth? And that's almost certainly not the case. There are various different numbers of implants depending on the size of the space, the amount of bone that's available, how you're biting down on it, the way that your bite fits together. And we need to be able to assess all these options to be able to give you a definitive reason for a number of implants and exactly what is ideal and suited and tailored to yourself. So there is no kind of one approach to being able to do it. And what the responsibility is for our dentists is to be able to advise you on how many would be required after assessing all these needs. So if you're interested in having a dental implant, whether it's a one tooth gap, whether it's a 2, 3, 4, 5 full mouth implant treatment, come and see us. Let our girls go over some of the options available to you and advise you on what they think is involved, time frames, for getting everything complete, and be able just to, you know, go over all the costs with you to make sure that you are well aware, well educated, know about how we do it our own definitive way of placing implants, be that with pain-free injection systems, with lasers and the things that we feel that work best in our hands to provide great results for our patients.